Assalamualaikum doctors. In this video I am discussing how can we take the history of rectal bleeding per rectum, bleeding from the back passage. So first this is the chief complaints, analyzing first of all bleeding onset, course and durations, anything make it better and anything make it worse. Hookup. What is the hookup? That the child is hemodynamically stable or not, that is the child becomes fainted after that onset. The color of the bleeding, is it fresh or not, then associated with the bleeding, anything association with the bleeding. These are and bowel habit. Okay, so is it at the beginning of the poo or at the end or in the whole poo? Fast attack or recurrent occur, painful or painless? These are we are asking. Then other concerns are any dysmorphic features and chronic illness. GIT about the tummy size, tummy pain, throwing up, poo, loose motion or constipation, mucus in the poo, oral soreness, red eye, yellow eye, dilated blood vessels or blood tubes on the tummy. So we know portal hypertension, dilated blood tubes, Kafut medusa we are searching. Previous any bug, rota or interceptions. Hematologically, the child is become pale or bruises, bleeding or bugs. Generally FWASL, fever, weight, activity and sleep. And recent illness. CNS about the weakness, facial asymmetry, eye deviation, concern about vision, hearing or speech. Abnormal movement and abnormal walk. Chest about the recurrent bugs, cough, pain, rapid breathing. CVS asked in hookup. Urinary the pee, color and amount. Number of the diaper per day, bugs, blood pressure, pee control if old. MSK about the skin spot, discolorations, especially around the mouth, eczema, lumps, swelling, bone, muscle and joint pain, bone deformity, especially forearm, pulse in the neonate, and the endocrine. Past history 5 TIUA, drugs in the home or to child, bleeding from the IM injection, swelling or circumcisions. So is there any bleeding from any time like IM injections, circumcisions? Parental history, vitamin K after birth, puberty if in its time, vaccinations, allergy or cow's milk, protein allergy and eczema, nutrition about the breast or formula fed, fussy eater and vitamin deficiency, development growth chart, family history of bleeding, polyps or cancer, who takes care of the child, any possible threat to his safety at home. So this is very important, any possible threat to his safety at home. Social or any psychological problem, isolation, depression, bullying at school, suicidal attempts or thoughts, and psychological impact. So again, hookup meaning I am telling first of all hemodynamically stable, that is fainting or awareness of the heartbeat, onset, color of the patient pee poo, these are. Amount, what is the amount of the blood and the bleeding from other side. So amount of the blood and bleeding from other side. So bleeding per rectum, that is hematochezia. What is hematochezia? Hematochezia is the fresh bleeding and the melena is the black terry blood. False hematochezia, bleeding from urethra or vagina. There are some degree comes in our mind when we take this history. General causes and the local causes. General causes are hypertension. So hypertension 1 is the cause, liver disease, vitamin K deficiency in the first 6 months, then hemorrhagic disease of the newborn, bleeding disorder like platelet coagulation and vascular, and sepsis. Local causes are constipation or anal fissure, piles, portal hypertension, polyps are isolated, Pearce Jeghers and familial adenomatosis, adenomatous polyposis. Then Meckel's diverticulum, necrotizing enterocolitis, bloody diarrhea, Henoscolin purpura, intersusceptions, IBD, cosmic protein allergy, parasitic and chylostoma, trauma, sexual abuse, then Munchausen by proxy, drugs are iron and aspirin and tumor. So this is all about bleeding per rectum history. How can we take bleeding per rectum, hypertension we are keeping in mind, our mind, even intersusception Henoscolin purpura, we know rash present if the features is supporting, sexual abuse come NAI, that is tumor, and constipation also present, and IBD, inflammatory bowel disease, especially the Crohn's disease come in exam, bleeding per rectum. So this is all about this history. Thank you.